Hi, thank you everyone. It is such an honor to be here with you today. My name is Shannon Wisely, and I'm a licensed mental health counselor practicing here in Fort Myers. Over the years, I have worked as a therapist in many different settings and with several different client populations. In 2013, I made the decision to devote my career to the field of maternal mental health. This path was made clear to me after my own experience of postpartum distress following the birth of my first child. I found out that there were no mental health clinicians in Southwest Florida who had specialized training in this area. I received my postgraduate training through Postpartum Support International and now provide counseling to pregnant and postpartum women and those struggling with infertility or grief from loss. I most commonly see women who are struggling with anxiety or depression, either during pregnancy or during the postpartum period. Sadly, I also see a great number of women who are experiencing post-traumatic symptoms following the events from a traumatic birth. When I'm not working directly with clients, I can often be found giving presentations like this to different groups of people within our community. Educating medical professionals, social workers, and groups of moms alike on the topic of maternal mental health is such an important part of my work. The phrase maternal mental health is a relatively newer term that encompasses all aspects of mental health that can afflict a woman during her perinatal years. The term perinatal refers to the period of time surrounding pregnancy, birth, and postpartum. Maternal mental health, or its synonym, perinatal mental health, replace the outdated and limiting term postpartum depression. I'm sure that most of you have heard of postpartum depression. In fact, since 1 in 5 women experience this very common illness, it is likely that you or someone you know has suffered from it. Furthermore, since the 1 in 5 statistic only includes the number of women who have been identified by their medical providers, most experts in my field believe that the number is actually much higher. The problem is that postpartum depression is a misleading and limiting term that can lead to confusion and underdiagnosis. We now know that emotional struggles don't always occur during the postpartum phase and can begin during pregnancy or at any time during the first postpartum year. Another issue is that the symptoms don't always look like depression. In fact, it is now understood that symptoms of anxiety are actually more prevalent than depressive symptoms during the perinatal time. The umbrella term, perinatal mood and anxiety disorders, or PMADS for short, was created in order to encompass the wide range of symptomology that women can experience during this time. In addition to perinatal depression and anxiety, experts have been able to identify several other conditions. We now understand that for some women, their suffering is characterized by intrusive and scary thoughts. This disorder is called perinatal OCD, or obsessive compulsive disorder. Some women experience a trauma response that can occur following a traumatic pregnancy or birth event. Most often, those symptoms are marked by avoidance, hyperarousal, nightmares, and even flashbacks. We diagnose this as perinatal PTSD. And perhaps the most severe example of perinatal distress is that of perinatal psychosis. This is a rare but serious condition that requires emergency treatment. This is when the mother enters a psychotic state and is at great risk for harm to herself and others. Many of these disorders can overlap or share symptoms. All require important distinctions in diagnosis that must be made by a trained professional. These distinctions are sometimes a matter of life or death. In fact, recent research suggests that maternal suicide is one of the leading causes of death during pregnancy and the first postpartum year. As you can see, there are many ways that emotional distress can display itself, and things aren't always what they seem. Some of my most severe cases have been women who appear from the outside to have it all together. Hair and makeup done, well-dressed, eloquent, all the while extremely depressed and having dark and scary thoughts. You can't always tell who is struggling from outward appearance. That brings me to my next point. Maternal mental health issues do not discriminate. These difficulties can happen to anyone, regardless of age, ethnicity, religious beliefs, financial and educational status, or the amount of support one has. These issues are pervasive and affect millions of women every day. But yet, many women are never even screened by their OBs for mental health issues, and even fewer ever receive treatment. But how could this be? For a problem that has existed since the beginning of time and is so prevalent. In my clinical observation, it comes down to one word. That word is stigma. Stigma. In other words, the shame, disgrace, and humiliation. Mental health problems in general have always carried a great deal of stigma within our society. We do not view mental health the same way as physical health. People are much more comfortable telling you that they have kidney stones than they are telling you that they have depression. Any pregnant woman can tell you how much emphasis is placed upon her physical health, how big the baby is measuring. Is she receiving education on the warning signs of preeclampsia? Having the glucose test for gestational diabetes. The list goes on and on. And yet, a pregnant patient is almost never asked about her mental and emotional state. At a 20% incident rate, that puts perinatal depression and anxiety as the most common complication of childbirth. That's more common than gestational diabetes and preeclampsia combined. Also, there is an added layer of stigma associated with maternal mental health that is unlike other mental health problems. The myth of motherhood. Motherhood has long been regarded in our society as a magical time of joy and love and sunshine and rainbows. And for many women, it's anything but. Many women are so ashamed and fraught with guilt that they do not even tell their partners or closest friends how badly they're feeling, for fear of being viewed as a bad mother. I've had many clients tell me that they were so afraid of their thoughts that they believed their children would be taken away from them if anyone knew what they were thinking. Almost every client I've ever seen has said that they thought they were the only one who ever felt this way, and that nobody ever told them this could happen. Our expectations of what motherhood will be like are not always met, and women often feel inadequate when their reality does not match their expectations. But the truth is, becoming a mother is hard, even under the best of circumstances. So what can we do to break down the stigma associated with maternal mental health and get women the help they so desperately need? If you're a mental health provider, it is crucial to assess the pregnancy and postpartum status of your clients. You are in a position to educate your client on the prevalence and encourage treatment options. If you are still in the childbearing years, please don't be afraid to reach out and talk to someone if you are feeling anxious or depressed. With the right treatment, most women make quick and full recoveries. You are past this stage, but have gone through this yourself. Don't be afraid to tell other women your story. Normalizing these experiences helps women to feel they are not alone. And for all of us, if you have a friend, a sister, a cousin who is pregnant or recently had a baby, don't be afraid to ask her how she's feeling emotionally. Look her in the eyes and ask the real questions. Let her know that you care about her and offer your support. Encourage her to talk to her doctor and find a therapist who can help. Doing this could literally save someone's life. While resources for pregnant and postpartum women remain limited, there is hope. As I mentioned a moment ago, the Prognosis for Maternal Mental Health As I mentioned a moment ago, the prognosis for maternal mental health disorders is quite good. With the appropriate treatment, women do get better. Medication, therapy, and support groups are the gold standard of care. Postpartum Support International is a great resource for anyone seeking therapists and psychiatrists who are trained in this field. They also offer free online support groups for moms and dads. In 2016, the U.S. Preventative Services Task Force recommended that all obstetric and pediatric practices begin screening pregnant and postpartum women for depression. Many practices have begun to use the Edinburgh Postnatal Depression Scale with their patients. This is a 10-question screening tool that asks questions about depressive and anxious symptoms and about thoughts of self-harm. And while this is an important step towards identifying and treating more women, it has its flaws. I've had many women tell me that they were too afraid to answer the questions truthfully. Worse yet, I've had women tell me that they answered the questions in such a way that would surely indicate severe depression or high anxiety, but their results were never discussed with them. We still have so much further to go. Becoming a mother is a magnificent, joyous, and rewarding process, but it is also scary, thankless, overwhelming, and the most difficult transition a woman can experience in her life. Having a baby can unearth past emotional wounds, rock an otherwise stable relationship, and has the power to change a woman's identity. This is no small thing. And through greater awareness and communication, I believe that mothers can gain the support and recognition they so deserve. Thank you so much.
Shannon, that was really spectacular. Thank you for such a rich, thoughtful, and informative talk about something that I know, speaking personally, the area that you're talking about is something that, particularly as a man, worries me a lot. And so I really appreciate the wisdom that you've shown us today. And you are a real community gem. We appreciate all the work you're doing. So what I'd like to do is to invite you back and just talk a little bit about the services you provide. Just to, very briefly go through what it is that you do and how we can best use you. So if you don't mind, thank you very much.
Hello, me again. As I mentioned before, my name is Shannon Wisely, and I am the lead therapist for Shannon Wisely Counseling. We provide mental health counseling to pregnant and postpartum moms and those struggling with fertility difficulties and grief issues from perinatal loss. I have 2 associate counselors as well as graduate students who are able to offer a range of fees for services. We are located on College Parkway in Fort Myers, Florida, and you can find more information and contact us through my website, which is just shannonwisely.com. Thank you.